I'm a nursing student. I'm here to do an assessment on you, a full head to toe assessment. It should take about 25 to 30 minutes. Is that okay? Okay, can you state your name and date of birth for me while I check your ID? Thank you, Mr. James. Patient appears his stated age. There's no signs of distress. Patient's facial features are relaxed. Behavior is normal. Patient is alert and oriented to person, place, time, situation, and basic speech. Patient is freshly out of a shower, so he is freshly groomed. Good hygiene. Hair is freshly brushed. I observed my patient walking from the bathroom back to bed. His posture is erect. He's able to move with ease. He's using no assist devices. There's no involuntary movements, and he's symmetrical. Okay, so now I'm going to start with his vitals. I'm going to start with the apical pulse. Apical pulse is the 5th intercostal, midvicular. I would listen to this for 1 full minute. And apical pulse is 82. I would also take his radial pulse. Radial pulse, I'm going to listen at for 30 seconds and then times that by 2. Pulse is 82. Then I would check respirations. Respirations, I'm going to listen to my patient breathe. 1 inhale and 1 exhale is 1 breath. Patient's respiration, I would listen to it for 30 seconds, times it by 2. Patient's respirations are 18 within normal. I would then take pulse ox. We want closest to 100%. Patient's oxygen is 99%. He is fine on room air, so no need for oxygen. Then I'm going to take patient's blood pressure. I would place the cuff around the patient's brachial artery. Patient's blood pressure is 122/78 within normal limits. I would then take his temperature. Temperature I've taken orally is 97.8. That's within normal limits. If oral was contraindicated, he had just had mouth surgery or drank or ate something hot or cold, I could take temporal or axillary. So now that I have done my full set of vitals, all within normal limits, I'm going to move on to your head. I'm going to first just look at overall shape. Shape is even. Facial features are symmetrical. Lips are pink and moist. I'm going to inspect your scalp. Scalp is free of any infestation of bugs. I see no masses. There's no tenderness. There's no abrasions. Hair is abundant, black, and soft, freshly combed from the shower. So now I'm going to palpate your carotid artery. I'm going to do one at a time. It's even and 2+, even and 2+. I'm going to now palpate your lymph nodes. We have the pre-auricular, post-auricular, the occipitals behind. Then we have the tonsillar, submental, submandibular, submental, the anterior cervical, posterior cervical, and the supraclavicular. Okay. Neck is symmetrical, shoulders are even, trachea and substernal notch are midline. Now that that is done, I'm going to lightly palpate your head. I'm checking for any masses or tenderness. Patient denies any pain. Okay. Now we're going to move on to your eyes. So eyes are symmetrical bilaterally. Eyebrows are present. Eyelids are free of any abrasions or cuts. I see no lacrimal drainage. The sclera is white. The conjunctiva is clear. Now I'm going to check for pearla. Pupils are even, round, and reacting to light. Now I'm going to do accommodation. If you can please follow my pen in. Perfect, thank you. Now we're going to do your EOMs. I'm going to move my pen, and if you could just follow with just your eyes, don't move your head. Perfect, thank you. Okay, so now we're gonna move on to your ears. I'm checking the auricular, the lobe, the tragus. I'm checking for any skin breakdown, lesions, or drainage. I'm gonna perform the whisper test. I'm gonna cover this ear, and if you can, I'm gonna say 3 words. If you can repeat them back to me. 1, 2, 3. Good. Now I'm gonna go to the other side. Okay. I'm checking this side's auricle, the tragus, and the lobes for any lesions, discharge, drainage, or skin breakdown. There is none. I'm going to perform the whisper test on this side as well, okay? I'm going to repeat 3 words while covering your ear. If you can repeat them back to me. Red, white, and blue. Good. Okay. Now we're going to move on to your nose. Okay. Mucous membranes are intact. I see no septum deviation. I'm going to close one nares. If you can take a deep breath for me. Okay. And again. Okay. I see no patency or flaring. Now we're going to check your mouth. I'm checking the cheek pupil, the sublingual mucus, soft and hard palate, all intact. Teeth are patient's own. There's no loose teeth, no dentures, no decay. There's no dentures. Gums are pink. Uvula and tonsils are midline. Okay, so now that we are done with your head, I'm going to move on to your respirations. Just going to move your gown down. Okay. Patient is a mouth breather. I see no use of accessory muscles or retractions. Patient has no coughs. There's no sputum. I'm going to check the jugular vein. Okay, now I'm going to check for JVD. So I would lay my patient flat. I would see a slight pulsation. I would then slowly move the bed up 30 degrees. Pulsation is gone, so patient is negative for JVD. I'm going to check your extremities. So extremities are warm to the touch. Patient has hair on all extremities. There's no deformities. Hands are intact and warm. There's no skin breakdown or lesions. Feet are warm and intact, no skin breakdown or lesions. I'm going to check capillary refills on all 10 toes, all less than 3 seconds. I'm going to check capillary refills on all 10 fingers, all less than 3 seconds. Okay, now that that is done, we are going to move on to, I'm going to palpate your chest. I'm checking for any masses, tenderness, or crepitus, all negative. I'm going to now lightly palpate your 5 carotid landmarks. We have the second intercostal to the right is the aorta. Second intercostal to the left is the pulmonic. Third intercostal to the right is the urbs. Fourth intercostal to the right is the tricuspid. And fifth intercostal is your apical. I was checking for heaves or lifts, all negative. I'm going to now check your pulses. I have the radial pulse, even 2+, the femoral, even 2+, popliteal, even 2+, posterior tibial is even 2+, the pedal is even in 2+. I'm going to also check your chest is symmetrical bilaterally. It's 2 to 1. I'm also going to check your chest expansion. So if you can take a deep breath for me. Good. Chest expansion is equal bilaterally, normal depth. Okay. So now that we have, I'm going to move on to your abdomen. Abdomen contour is flat and symmetrical. Patient's color is adequate to his ethnic background. There are no pulsations, scars, striae, petechia, masses, or bulges. Umbilicus is midline. I'm also going to just inspect your genitalia. Genitalia has healthy tissue. There's no lesions, no discharge, no skin breakdown. Patient had a bowel movement and voided 2 hours ago. Stool was brown and soft. His void was clear and yellow, both normal. So now I'm going to auscultate your lungs. I'm going to use my ladder technique. Okay, I hear clear breath sounds, no crackles or wheezing. I'm going to now auscultate your 5 landmarks, which I've already stated their location earlier. Okay, now I'm going to auscultate your bowel sounds. I hear active, normal bowel sounds. So now that I've auscultated, I'm going to gently palpate your abdomen. I'm checking for any masses, tenderness, or abrasions. All negative. Okay, so now that that is done, we are gonna move on to your extremities. I'm going to feel your extremities. I'm checking muscle tone, any atrophy, making sure everything is symmetrical. Okay. Muscle tone is equal bilaterally. I'm checking for any masses, any tenderness, or any edema in the bony prominence. You are negative for everything. I watched my patient's gait earlier. He has even movements, no tremors, tics, or unevenness. I also performed the Romberg test. That was negative. I'm going to now do the sensitivity test on you. If you can close your eyes and tell me where you feel my pen light. Great, thank you. Okay, so now I'm going to have you squeeze my hands. I'm checking for grip strength. Good. And if you can push up on my hands, push down on my hands. Good. And now we're going to do with some resistance. If you can pick your legs straight up for me and pick your arms straight up for me. Okay, good. All right, so now that that is done, I would also have listened to my patient posteriorly and laterally for his lung sounds and cardiac landmarks. Patient's skin is warm to the touch. Color matches his ethnic background. No deformities. I would also be assessing the skin posteriorly. So now that that is done, I would have my patient perform range of motion. So if we're going to start with your head, if you can please turn your head to the left and touch your shoulder. Good. Turn to the right and touch your shoulder. Good. Now we're going to do it with some resistance. If you can push against my hand to the left and to the right with my hand. Good. Okay. Now the last range of motions are going to be flex, extend, supination, pronation, abduct, adduct, and circumduction. Now that I have finished my full assessment, is there anything else you need? No? Okay, well here's your call light, and you give us a call if you need anything. I'm going to put you back into the lowest position in the bed. I'm going to wash my hands, and you give us a page if you need anything. Thank you.